part of the reason that GOP leaders are being so vague is that they're trying to craft a bill that will win over conservatives like Lee and more moderate Republicans like McCain. And so in reality, Vlad, nothing is final right now. There are no details to share because they're not going to be able to make those details public until they feel that they have hit on something that they think can win over 50 of 52 Republican senators. That's what they need for passage.
And to that end, Nancy, Senate Majority Leader Mitch McConnell says Republican senators will be releasing a discussion draft of the Senate health care bill later this week and want a vote next week. Is that a tight timeline, and does it provide enough time for debate and amendments?
It's an incredibly tight timeline, and there are still a lot of unanswered questions about it. How detailed will this discussion draft be? Are we going to be looking at actual legislative language or just a bunch of bullet points? When will we see details from the Congressional Budget Office, which has been examining bits and pieces of this plan to understand, A, how much it costs, B, how people might be affected? Are they going to pay more? Are they going to pay less? You remember that it was a big hang-up that the Congressional Budget Office determined that 24 million fewer people would have insurance under the Republican plan in the House. What do the numbers look like in the Senate? That could have a big impact on whether some of the more moderate Republicans in the Senate decide to sign on. So yes, it is an incredibly tight time frame, and part of the reason that Republican leaders are structuring it that way is that they don't want to give Republicans who might be, wavering about this plan more time to dig in one way or the other. They don't want Republicans going home for a week-long recess and hearing from their constituents that they think that this plan is terrible and they want them to vote against it. They want to get it out there and convince their Republican colleagues that this is the only train leaving the station and they need to get on board.
And yet, as you know, Nancy, the latest CBS News poll shows 73% of Americans want the Senate to debate the health care plan publicly, and another poll finds more Americans believe the Republican plans will hurt rather than help them. So what role is how the public is perceiving this health care bill from the Senate? How is that playing in conversations about repealing and replacing the Affordable Care Act?
Well, Democrats are hoping that that perception counts for a lot. That's why you saw them doing things like going off to the Congressional Budget Office in search of the bill and trying to get as much publicity for things like that as possible, even though it doesn't really do much to move the needle legislatively. They want to get the public engaged. They want people to be angry. They're saying point blank, if you think that this is problematic, call your member of Congress and tell them. But I will tell you, Vlad, that if Senate Republicans do manage to pass this bill before the July 4th recess, there's really going to be no recourse for Democrats, because even if Republicans do get an earful from their constituents who are very upset about the way that this was done, it will be too late because they will have already voted.
And so, Nancy, when the Senate does vote on its health care plan, as you pointed out, the Republicans will need just about everyone in their party on board, but some Republican senators are saying they feel left out of the discussion.
Right.
What is the strategy here to win over those that are feeling disenfranchised?
So the strategy is that you don't put any of the details out there, because that just invites the possibility that a senator who's off on one side or on the other side sees it and says, well, I can't get behind that. And then they're kind of stuck. You can't kind of meet with them behind closed doors and bring them around if they've already said publicly that they're against it. So it's this very delicate dance of briefing senators in private, asking them not to share the details, feeling them out to see if they could be supportive, and then if they're not, and you need to win them over, then you try to tweak the bill this way or that way to get them on board. The challenge here is that the president has now described the House bill that passed a couple of months ago as mean, and says that the Senate bill needs to have more heart. That's what he told a group of CEOs on Tuesday. And so Senate Republican leaders are trying to craft something that is the theoretically less mean and has more heart than the House bill, but they know that if they retain too many features of Obamacare, then conservatives are going to balk. So, they're really trying to thread a tiny, tiny needle here with very little room for error, especially since they know they can't count on any Democratic votes.
Nancy Cordes on Capitol Hill for us. Thank you, Nancy.
You're welcome.